I'm Dr. Halbert. How are we doing today?
Good, how you doing?
Alrighty, so what I'm going to be doing is I'm going to be doing a general scan of your spine from approximately the back of your neck to the lower portion of your back. So at any moment if I need you to expose your skin, is that okay?
Yes.
And can I have you take off your shirt?
Yes.
Alright, I'm going to check the table real fast. Alright, if I can just have you sit right here, just face this wall, please.
Okay.
Alright, I don't feel restrictions. I'm going to continue up the spine. Alright, I do feel a restriction here in the lumbar area. Top of the neck crease to the level of L4. I'm going to put my finger in the inner spinous space between L4 and L5 where I felt this restriction. If I can have you cross your arms for me, please. What I'm going to do is I'm going to flex him forward, looking for that inner spinous space to open up, which I do not feel. So now I'm going to assess the rotation and lateral bending of this segment. I'm going to go to the lateral portion on the left side of the L4, L5 segment. Have you cross your arms? I'm going to rotate him to the left. I should feel those spinous spaces opening up, which I don't, indicating that he has a left rotation restriction. I'm going to laterally bend him again on that lateral portion. Springing lateral medial for end play, which I don't feel, indicating that he has a left lateral bending restriction as well. I'm going to go to the other side. Once again on the lateral portion of the L4, L5 segment. Have you crossed your arm? I'm going to rotate him to the right. Springing lateral to medial. I do feel that spinous space opening up. I'm going to laterally bend him now. Springing lateral to medial. And that space does open up. So what he does have on the left side is a left rotational restriction and a left lateral bending restriction. I always lose my breath. Okay, now I'm going to continue back up the spine. I do feel restriction in the thoracic area, so I'm going to have you pull your arms back for me, please. I'm going to go to the inferior border of the scapula to the midline right here. This is about the T7 spinous process. Sorry. So what I'm going to do is I'm put my finger in between the T7, T8 interspinous space. Can I have you cross your arms for me, please? I'm going to flex him forward. I'm looking for that interspinous space to open up, which it doesn't, indicating he has a restriction. So what I'm going to do is I'm going to assess rotation and lateral bending. I'm going to put my finger on the lateral portion of the T7, T8 segment. I'm going to rotate him to the left, pressing lateral to medial. Alright, that feels good. I'm going to rotate him to the left, pressing lateral to medial. That inner spinous space does open up, so that is a healthy joint. I'm going to assess the right side. On the lateral portion, once again, cross your arms. I'm going to rotate him to the right. I should feel that space opening up when I press lateral to medial, and I do not. Let me lateral bend him. And that feels alright. So he has a right rotational restriction in the thoracics. Now what I'm going to do is I'm going to assess his ribs. If I can have you pull your arms back again for me, please. Go back to that segment. Alright. So I'm back on the T7. I'm going to move up 2 interspinous spaces. 1, 2. I'm going to go out an inch laterally and another inch to the corresponding rib. What I'm going to do is I'm going to assess elevation of this rib joint. So what I'm going to do is have you cross your arms for me, please. For elevation, I'm going to be on the inferior portion. And I'm going to rotate him, laterally bend, and flex him on the contralateral side. So, flexing, rotating, bending. I'm going to push inferior to superior, and I do feel that joint opening up, so that it is a healthy rib. To assess depression, I'm going to be on the superior border of that rib. I'm going to extend him, laterally rotate, and bend to the ipsilateral side, pressing superior to inferior, looking for that rib to close down, which it does. I'm going to assess the left side as well now. So I'm going to be on that T7 segment. I'm going to go out an inch and another inch to be on the corresponding rib. And to assess elevation, I'm going to be on the inferior border. So I'm on the inferior border. I'm going to have you cross your arms again. I'm going to flex him, laterally bend and rotate to the contralateral side, pressing inferior to superior. I should feel that rib space opening up, which I do. Now to find depression, I'm going to be on the superior border of that rib. I'm going to ipsilaterally rotate, bend, and extend to assess depression, pushing superior to inferior, looking for that rib space to close, which I do, indicating he had a healthy rib. So now I'm going to continue with the general scan of the spine to the cervicals. Can I touch your face? Alright, and I do feel a restriction right here. So what I'm going to do is I'm going to place my hands on the articular pillars. I'm going to slide back onto me real fast. Alright, so I'm going to be assessing the rotation and lateral bending of this C3 segment. So what I'm going to do is I'm going to rotate you to the left, my fingers on your articular pillars. I do feel restriction going to the left, to the right. I felt a restriction on left rotation, so he has a left rotation restriction. I'm going to assess lateral bending. And here I'm going to be on my contact point as my spine, the spinous process. As I laterally bend to the left, I should feel those spinous processes buckling, which I do not feel going to the left. Going to the right, he does have more movement, so he has a left rotation, left lateral bending restriction on his C3. That is it.